Welcome to Pharmacology Insights, where we break down complex pharmacology into simple, easy-to-understand concepts. Struggling to read small print as you get older? You are not alone. Presbyopia affects more than 100 million adults in the US alone. It's why reading glasses are practically a rite of passage after 40. But now they may have serious competition. In August 2025, the U.S. Food and Drug Administration approved the first Aceclidine-based eye drop for presbyopia, marketed under the brand name Viz. This once-daily drop can improve near vision for up to 10 hours, without the need for glasses. In this video, we're breaking down how Aceclidine works and why it's a game-changer. Presbyopia occurs when the eye's lens becomes less flexible with age, making it harder to focus on near objects. Normally, when you look at something up close, your brain sends a signal through the parasympathetic nervous system. Acetylcholine is released and binds to muscarinic M3 receptors in the ciliary muscle. This makes the ciliary muscle contract, loosening the zonular fibers, allowing the lens to round up for near focus. But as the lens stiffens with age, even full M3 receptor activation can't restore its shape. So, near vision blurs and reading glasses become the usual fix. Alright, let's talk about how Aceclidine works. But first, we need to understand how your pupils normally change size. Think of your eye like a camera. The pupil is the aperture, it decides how much light gets in. And just like a camera, it can get bigger or smaller depending on the situation. Here's how. Normally, pupil size is controlled by two opposing forces. The parasympathetic nervous system releases acetylcholine onto muscarinic M3 receptors in the iris sphincter muscle, causing it to contract. This constricts the pupil, or what is known as miosis. In contrast, the sympathetic nervous system releases norepinephrine onto alpha-1 receptors in the iris dilator muscle, causing it to contract radially and dilate the pupil. This is mydriasis. Now here's where Aceclidine comes in. Aceclidine is a parasympathomimetic. It mimics the natural parasympathetic signal. But it's a bit more selective. Instead of affecting everything, it specifically targets the M3 receptors on the sphincter muscle. That makes the pupil constrict, without strongly activating the ciliary muscle that normally helps the lens focus. Why is that important? Because when your pupil shrinks, it creates what's called a pinhole effect. Just like narrowing the aperture on a camera. The smaller opening increases depth of focus, so near objects look sharper, even if the lens itself has lost flexibility with age. The first presbyopia eye drop, Vuity, hit the market in 2021. The active ingredient of Vuity is pilocarpine hydrochloride. It works via a dual action, pupil constriction plus ciliary muscle stimulation. However, pilocarpine can induce a myopic shift, meaning it can temporarily shift focus toward near objects at the expense of clarity in distance vision. It is also associated with side effects like brow heaviness, eye ache, or in rare cases, vitreoretinal complications. The newly approved Aceclidine formulation stands out because it only targets the iris sphincter's M3 receptor. By skipping ciliary muscle stimulation, near vision can be improved without compromising distance vision. It is also longer lasting, up to 10 hours with once daily use. FDA approval was based on 3 randomized, double-masked, controlled phase 3 studies. Aceclidine demonstrated its ability to improve near vision within 30 minutes and last up to 10 hours. Specifically, an April 2024 news release states that 71% of trial participants achieved 3-line or greater improvement at 30 minutes and 3 hours. And 40% continued to have these improvements at 10 hours. Of note, Aceclidine was well tolerated, with no serious adverse events reported over 30,000 treatment days across all 3 trials. It may still cause mild eye redness, temporary stinging, or reduced vision in dim light. Aceclidine is not suitable for people with certain eye conditions, such as uveitis or a high risk of retinal detachment. To sum up, aceclidine sharpens near vision by selectively constricting the pupil, creating a pinhole effect without compromising distance vision, or causing the discomfort linked to pilocarpine. For millions living with presbyopia, that's not just a new option. It's a clearer future. And that's it for today's pharmacology video. If you enjoyed this video, please give it a thumbs up and subscribe to the channel for more pharmacology content.